Hello, Medicare Advantage Risk Adjustment operators, innovators, and learners. Welcome to another learning episode of the Hughes Academy Risk Adjustment Made Easy, the Medicare Advantage Kind learning series. We are in a new month and we are starting a new learning episode that we believe will be very impactful for you, especially if you're very new to the space of Medicare Advantage Risk Adjustment. I am your host tutor, Dr. Prince Bewa. If today is your first time joining us, we want to say welcome. And if you have been with us, welcome as well. If you have not subscribed to our channel, we will encourage you to subscribe because it helps reach a wider audience. This month, we are looking at 4 Medicare Advantage Risk Adjustment stakeholders that you should know. 4 Medicare Advantage Risk Adjustment stakeholders that you should know because they really have a voice in this space, and you can learn a lot from navigating through the work that they do because it helps you in learning in the space of Medicare Advantage Risk Adjustment. First one is AHIP. AHIP was formerly known as the America's Health Insurance Plan. And if you have been in this space, you probably have seen their resources, their names somewhere. AHIP is a national trade association. It covers the entire US and it represents health insurance providers in the United States. So this means that AHIP covers not only Medicare Advantage space, but it covers ACA space and Medicaid and the other health insurance areas within the US, but it's a private trade association here. It plays a significant role in advocating for Medicare Advantage, pulling this in the context of what we look at Medicare Advantage specifically. AHIP plays a significant role in MA plans, which are private alternatives to the traditional Medicare, which is the fee-for-service. Moreover, as we get this from the AHIP website, it says AHIP is a national association whose members provide healthcare coverage, services, and solutions to hundreds of millions of Americans every day. So, as I said before, it's a trade association. The members provide health coverage and services and solutions. Not only is it looking at health insurance organizations, because there are some organizations that may provide services and solutions, and they are committed to market-based solutions and public-private partnerships that make healthcare better to help create a space where coverage is more affordable and accessible. So as you are in the space, AHIP's work will be very important to you to learn, to navigate, to understand, because it will affect policies that affect operations, that affects the things that Congress and CMS does. So you want to really be cognizant with AHIP and the work that they do in the Medicare Advantage Risk Adjustment space. AHIP offers membership, and its membership is to health insurance providers as well as solution providers. You could tell for initially it was American Health Insurance Plans, which was the name, but now it is known as AHIP because now you can tell from the membership that it doesn't only include insurance providers, but AHIP membership has now extended beyond that to provide membership to solution providers and other industry stakeholders. And you can now see why the name has been changed from formerly called American Health Insurance Plans to now AHIP, simply to cover the rest of the stakeholders that they are pulling together in their membership. AHIP's work in Medicare Advantage Risk Adjustment include advocacy and policy development. So AHIP actively promotes Medicare Advantage as the cost-effective and high-quality alternative to traditional Medicare. Moreover, AHIP also publishes research and reports on studies that are showcasing the advantages of MA, because that is the leaning of AHIP for private market compared to traditional Medicare. So the research and the reports that AHIP publishes are more favorable many times to MA or in that MA space. So knowing where AHIP leans help you to understand what you need to do as you study their resources together. And the third one here is AHIP also has training and certification. So AHIP provide mandatory training, for example, to insurance agents that are selling Medicare Advantage plans. Now we will take some time and navigate through the AHIP website right now. The website you can see from here is www.ahip.org. AHIP has some news and some resources. You can see that there are some conferences that is being held by AHIP, from membership There's the organizational membership and individual membership, and then the corporate sponsorships. There was one report that was released today, and if you go to the news articles and press releases, it was an analysis that exposes additional flaws in MedPAC's report. And you'll see from here, new analysis exposes additional flaw in MedPAC report, and AHIP working with FTI consultant in looking at some of the research and the work that is being done on the Medicare Advantage space. So AHIP is a good organization to know, and their resources are good to learn in this space. Nonetheless, as you look at this space, you also want to understand where AHIP leans so that as you look through their reports, you are able to be a savvy consumer. If this has been helpful to you, I will encourage you to like, to share, to subscribe if you haven't already. And as we end, we want to invite you to be part of our email list if you're not already, and you get a free signature gift, which is From Chaos to Clarity, the essential comparison cheat sheet on Medicare Advantage risk adjustment data sources. Right here, that compares risk adjustment data sources for you in an easy way for you to consume. Otherwise, thank you for joining us today. We will see you next week as we look at stakeholder number 2. Bye for now.